Hello, everyone. Thank you for your interest in the ENT program here at Medical College of Georgia. This is Dr. Mingsi Li. I'm one of the rhinologists here at MCG. Today, I'm going to give you guys a presentation on the rhinology and the skull-based program here at Augusta University. The Rhinology Division is made up of 4 full-time attending faculty and a rhinology fellow. Dr. Stu Kontakis is the chairman of the ENT department and also the Rhinology Fellowship Director. Dr. Kim Bird is a fellowship-trained head and neck and skull-based surgeon. Dr. Camilo Reyes and myself are both fellowship-trained here at MCG for rhinology and skull-based surgery. Each year, we also have a rhinology fellow joining us, and this year is Dr. Lindsay Ryan, who joined us from University of South Florida. In terms of rhinology rotation, residents here will get rhinology exposure throughout their residency. Most of the exposure occurs during the PGY2 year and the PGY4, PGY5 year. The PGY2 year will typically operate mostly on patients with inflammatory disease, and the PGY4, PGY5 year will do both inflammatory and skull-based surgery. The residents will work at both Augusta University and at the VA Medical Center. At Augusta University, you'll be working with all of the rhinology faculty. At the VA, however, you'll be typically working with myself as well as the rhinology fellow. I will also take this opportunity to go over the VA rotations. A PGY1 and the PGY4 resident will rotate at the VA. For the PGY4 resident, it will be a 4 to 6 month chief resident rotation. Depends on how many residents in your class year. While you are at the VA, you will operate on all subspecialties, which includes general ENT, laryngology, rhinology, head and neck surgery, and endocrine surgery. You will cover most of the cases and cover clinic when there are no ORs. Typically, on average, as a PGY4, you will be in the OR 3 to 4 times 3 to 4 days per week. For the rhinology rotation of the VA, we typically have a very high volume of cases. Surgeries are typically booked out anywhere between 2 to 3 months. You have a weekly OR with either myself or with a rhinology fellow, and this leads to a high degree of repetition, allowing you to develop those skills to operate in the sinuses. The rhinology fellow has their own ORs and at the VA, and they will take the resident through cases. Typically, both myself and the rhinology fellow will let you operate on your own, and if you start to struggle, we'll sort of step in to help you get through the hurdle, and then let you resume the case. At the end of the VA rotation, we expect our PGY4s to be able to do complex endoscopic surgeries on their own, or at least being able to comfortably do the surgery on their own. In terms of skull-based surgery, most of your skull-based experience will be at the Augusta University with Dr. Kim Bird, Dr. Camilo Reyes, and myself. And this is typically for the PGY4 and the PGY5 residents who are rotating on the rhinology service. In terms of clinical experience, you'll be expected to cover rhinology clinic. In the clinic, you will learn to obtain H&P, perform endoscopies, as well as coming up with diagnosis and treatment plans. You will also learn clinic-based procedures such as nasal cautery, biopsies, and postoperative debridement. In terms of operative experience, here's a list of surgeries that we frequently perform, though this is obviously does not cover everything that we do. The common procedures that we do here includes primary and revision fesses, septoplasty and turbinate reduction, transfemoral pituitary surgeries, skull-based surgery with skull-based reconstruction, orbital decompression for patients with Graves' disease, or for those patients with infections. You will be exposed to a good amount of patient with a CSF leak, as well as encephalocele repairs. Well, you will also be able to do a lot of craniofacial resections for malignant disease, as well as advanced procedures such as frontal drill outs and resection of benign and malignant sinonasal neoplasms. Here are some of the images of the procedures that we do here at MCG. We frequently encounter patients with severe nasal polyposis, as you can be seen here. These patients will come in with basically polyps filling up their entire nasal cavity. We also treat a large amount of patients with allergic fungal sinusitis. This is a disease process that you typically see here in the south, but not so much as in the northern state due to the humidity down here. Frequently, the patient with the disease will have erosion of the bones around the skull base as well as the orbit, with fungal debris causing mass effect into those structures. Sinus surgery in these patients are typically more complex due to the distortion of the anatomy as well as a large degree of inflammation. We kind of expect you guys to be able to perform these complex surgeries so that those other uncomplicated surgeries will be much simpler. And we obviously, if you're able to do complex cases like this, you should have no problem doing simpler cases like a primary FAS, okay? Other surgeries that we do here are some of the other surgeries we do here are patients with benign disease, such as patient with inverted papilloma. We also do see a lot of patients with ossifying fibromas, as you can see here. We get a good amount of patients with CSF leaks. In these photos, you can see that we have somebody with a ethmoid roof CSF leak that is repaired using a mucosal graft. Lastly, here's some photos. Here's a photo of a patient who had a refractory frontal disease that required a frontal drill out. For those of you who are interested in research, the residents here are expected to conduct at least one research project per year that can be either in basic science, clinical research, or translational research. We have 4 months research block for you guys as a PGY3. And for those people who are interested in rhinology, we have a rhinological database that we collected over the last 15 years. And with the block time in our database, this leads to many peer-reviewed publications as well as presentations by our residents at the national meetings. In conclusion, we do have goals for our residents by the time they graduate from the program. We expect you to be able to diagnose and treat inflammatory diseases. We expect you to be able to perform primary and revision tests for disease involving the maxillary, the ethmoid, the spheno, and the frontal sinus. We are here to teach you to develop a systematic approach to sinus surgery so that you can avoid, orbital as well as skull-based complications. And should complication occur, we will teach you to be able to recognize it as well as manage the complications. Most importantly, the goal here is to make you become a safer surgeon. Thank you all again for your interest in the Medical College Georgia program. I look forward in meeting you guys during the interviews. Thank you.